It is not your fault that you have obesity. You did not choose to have obesity. Welcome back to the program, you beautiful people. My name is Dr. Dan. I'm a pharmacist turned weight management specialist, and today's video is going to be a little bit different than my usual critique. There's still going to be some funny parts, but this is definitely a more serious subject that I wanted to address. But before we dive into things here, please hit the subscribe button down below so that you don't miss another episode. As well, check me out on my other channels at the official Dr. Dan. I'm on the Twitter, the Gram, the Facebook, the LinkedIn, the TikTok, you name it. I am out there, and you can check me out there for my daily content. As well, you can check out my website, healthcareevolve.ca, where you can sign up for my daily newsletter. And if you feel like you need some additional support from myself and my team, you can sign up there for a free consult. So, obesity is a chronic disease. Obesity is a symptom. And obesity is a risk factor. Just like diabetes, just like high blood pressure, just like high cholesterol. These are all chronic conditions. So even if you have the perfect diet, you work out 3 hours every single day, you drink 6 glasses of blended grass clippings and apple cider vinegar. On your lunch hours, you go out and rescue puppies. You talk to a therapist. You align your chakras before bed. And hell, you maybe even have 8 single orgasms every single day with the perfect partner. You can still have a chronic disease. And please note, many of the above, I definitely don't recommend as part of a healthy lifestyle. I'm just really trying to over-exaggerate and make a point here. And to be quite honest, all of that sounds like fucking exhausting. I mean, 8 orgasms a day? I mean, would sex even be like fun anymore at that point? And I feel like there might be a bit of an issue in terms of like friction burns and stuff. So, yeah. Anywho, when it comes to chronic conditions, can our lifestyle ultimately affect them? And absolutely that is the case. No one is saying that your lifestyle won't have a benefit in managing them. You see, you can do all kinds of things throughout your life that are healthy, and they might help to reduce your risk of developing a chronic condition, maybe delay you developing that chronic condition, or may help you better manage that chronic condition. But at the end of the day, many of the chronic conditions that we develop, they are largely out of our control. Everything from the genetics that you inherit from your parents, to the people that you hang out with, to the city that you live in, is ultimately going to affect your health. Yet, when it comes to a condition like obesity, we see an individual living in a larger body, and we automatically say, it's your fault. You did this to yourself. You're the one that needs to put the fork down. Does anyone ever say to a patient that has cancer, oh shit, you got a tumor on your breast? Well, that was because you started wearing a bra at the age of 14 instead of waiting to the age of 16. And actually saying that out loud, I really wouldn't be surprised if some internet troll somewhere had actually said that to somebody that had cancer. But for those of us that aren't emotionally broken and fucked up, we would never say or actually even think something like that. And to be quite honest, if we were to dig deep enough into the past of an internet troll, we would actually probably find that them being an asshole and a dick on the internet is probably not their fault either. Likely the environment that they grew up in, the behaviors that they were modeled, and them just being who they are because of genetics and other things ultimately led to them being an internet asshole. But circling back here, of course, there's going to be a number of internet trolls that are going to come on this video and say obesity is different than cancer. And my question is, well, how are they different? They both are conditions with pathologies that we don't fully understand, but we know are likely and largely determined by genetics, environmental exposure, and other factors throughout our lives. And exercise, consuming more whole foods and vegetables and all that kind of crap might help to reduce your risk of developing them, but it's by no means a guarantee. And technically, neither one of them actually kills you directly. You see, what cancer does is it's an abnormal growth of cells that can ultimately infiltrate your organs, and they begin to grow and grow and grow and grow. But this growth of organs and taking up space ultimately causes a physiological dysfunction of the organ that can lead to things like a heart attack, a stroke, or what have you. In obesity, fat tissue, in particular visceral fat tissue, so that's fat around our organs, may, say, get into our liver or get around our heart, and that may ultimately lead to heart failure. Both conditions can be harmful and can be potentially deadly depending on what indirect effect they have on the body. So just because you have cancer or obesity, does that mean you're unhealthy? And absolutely not. People with both conditions can be very healthy and be leading very productive and fulfilling lives. You see, not every single cancer that we discover needs to be cut out, and not every single individual that has obesity needs to lose weight. And in fact, if we look at the definition of obesity, obesity is a chronic disease that involves an excess amount of fat tissue or adipose tissue that poses a health risk. And not all fat tissue is going to pose a health risk. Furthermore, losing weight does not automatically confer health benefits. And even if people do lose weight, we have a big question in a lot of circumstances. Is it because they lost weight, or is it because they started to engage in behaviors that ultimately those behaviors led to the improved health outcomes? And in reality, based on the literature and based on the science, you could make an argument for either side, and likely it's a combination of both of them with the activities and stuff that you're beginning to engage in, such as exercising more and consuming more veggies, having a greater overall benefit. Now, obviously, there's going to be caveats and blah, blah, blah when we get out to the extremes, but you get what I'm fucking saying here. You see, if managing obesity was a matter of choice and you just had to eat less and move more, well, you wouldn't have a weight issue. I wouldn't have had to make this video. There wouldn't be an obesity epidemic. And at this point in time, I would have been broken without a job, so I probably would have gone back to school and probably become a psychiatrist or some other kind of medical doctor. So you are not a failure for not being able to lose weight. You are not a failure for having obesity. There is nothing inherently wrong with you as an individual. This is something that is a very complex set of physiological, genetic, environmental factors, etc., the list goes on, that are largely out of your control. And just like the internet trolls out there, we need to learn how to show them empathy and compassion, because to say some of the things that they say, the amount of pain that they must be in, like they need that empathy and compassion. They need that love because they clearly have not gotten that. We also need to show ourselves that empathy and compassion and realize that this isn't our fault. The weight issues that we struggle with, the chronic conditions that we struggle with, are not our fault. We are all fundamentally doing the best that we can with what we have and where we have come from. So that is it for today, you beautiful people. Obesity is not your fault. The weight that you carry is not your fault. Be kind to yourself, and until next time, everybody, don't forget to hit the subscribe button down below. And of course, check me out on my other channels at The Official Dr. Dan. I'm on the Gram, the Facebook, the LinkedIn, the TikTok, you name it. As well, check out my website, healthcareevolved.ca. If you feel like you need some additional support in managing your weight, you can book a free consult with myself there. And until next time, people, we'll see you later.